Hello guys. This week we're talking about pediatrics, and at least for this first section. And one of the main things about pediatrics is pediatric patients are not small adults. I know sometimes we get in this thing that, okay, we just need smaller instruments, we just need smaller stuff, drapes and things like that. But really, pediatric patients are not small adults. So you have to make sure that you are looking at the special considerations that we have to um, uh, pay attention to as it relates to the pediatric patient. The first thing is that because of their size and because of their system immaturities, they're usually much colder. They don't, their thermoregulation is not the same as adults, so you have to make sure that you do a lot of preparatory work prior to bringing them into the operating room. The first thing is you have to make sure that you actually warm the room up, not just bring the French fry lights in or the warming lights in. You want those warming lights in. You want to make sure that you know how to measure, how to have them be properly distanced from the patient. Because it's one thing to have those lights in there, but it's another thing to have them in there and have them causing damage to the patient. You don't want the patient to be burned, right? And you really don't want burns on the back of the surgeon's neck or the surgical techs and those kinds of things. So you want to make sure that they are positioned in a way that the patient gets the maximum benefit from them and that they're not being damaged. You want to make sure that you have your heating blankets on the OR table, whether it's your bear hugger types or your water types. It just depends on what is it your institution uses. Or also, you want to make sure you see them having a flash. Make sure that your anesthesia provider has warm fluids, or that you have a fluid warmer available for your patients. The French fry lights, the warm blankets. A lot of times they have the little warm hats, T-shirts, depending on, of course, where they're having what kind of surgery they're having. The next thing you have to be really aware of is, well, depending on how you're getting them in, what is the age of the patient? Obviously, if they're an infant and they're having their separation anxiety, you want to make sure that you make arrangements for the mom or dad for a parent to bring the patient in. Of course, you're going to coordinate with that with the anesthesia provider. Or if the patient is willing to go with you, then you have to coordinate that also with the patient and the anesthesia provider. You have to be able to interact with the child, so you have to be aware of the stages of that particular child. Okay, and you have to know what the legal ages are for what we're considering a child, because you might see somebody who's 15 or 16 and think, well, that's not a child. But according to your hospital policy, if that person has not been emancipated, yeah, a 17-year-old is a child, because they're not considered an adult until they're over 18. Okay, so you just have to know they might be a 15-year-old emancipated child, or they might be a 17-year-old who is still at home with his parents. Okay, so you just have to be able to know and be respectful of the child at whatever age they happen to be. The next thing is the BOVI or electrosurgical monitoring plates. You have to make sure that they are age appropriate, weight appropriate. You can't just take an adult pad and put it on a baby, or you can't cut it down to size. Of course, you don't ever want to cut an electrocautery pad, but you want to make sure that you're looking at the pad and it will tell you the age of the patient. So whether it's an infant or a toddler or an adult, you need to know that you have the correct pad to put on the patient. Okay. Now, that being said, all those things being managed, then yeah, you are going to have obviously smaller instruments depending on what it is that you're doing. Obviously, if you're doing fractures on a 3-year-old, you're not going to use the same instrumentation that you're going to be using for a 18-year-old or an adult. So yes, in that respect, you are going to have smaller instrumentation or specific instrumentation. You, of course, are aware that medications or your dosage calculation is going to be critical in that age group. Of course, your anesthesia provider is going to be working with the dosages and medications on their end, but of course you have to also be aware that things that you're putting on the field are going to have very little room for mistakes in a pediatric patient. Of course, we never want to give a wrong dose for an adult, but of course, as adults, we do have a little bit more wiggle room as it relates to bodies having recourse for making up for those possible close calls. But pediatric patients don't have that type of cushioning, so you have to make sure that you really are being very careful with your dosage calculation and adding those things to the field. Obviously, the types of surgeries that you're going to be looking at are going to be your cleft palates, PE tubes for the pressure equalizing tubes for the ears. You know, the babies have the ear infections. You have a lot of bowel surgeries because, of course, the formation of the embryonic tubes don't come together as well as they should sometimes. So of course, then you have the different bowel atresias. You have the different types of surgeries for the stomach, like the pyloromyotomies, because the patient's not able to eat because, of course, you've got the strictures, Hirschsprung's disease, which is aganglionic bowel. So you need to be aware of what types of surgeries that are particular for babies. Imperforate anus, the omphalocele and gastroschisis are two surgeries that are very similar, but they're not exactly the same. So you want to know the differences between a gastroschisis and omphalocele. Okay, they're both types of congenital bowel issues, but they are different. So go ahead and check out the differences. Obviously, for boys, you're going to have undescended testicles sometimes. You're going to have the different, the hypospadias, hyperspadias repairs. You have a lot of heart defects, obviously patent ductus repair, coarctation of the aorta, valves, atrial septal defect, ventricular defects, ventricular septal defects, and then we talk about the different neural tube defects, the myelomeningocele, omphalocele. So be aware of those types of procedures because that's going to be your neuro. Then you have your syndactyles. So there are a lot of different surgeries for pediatrics, but really once you get into the different types of surgeries, it's like any other service, but you just have to be aware that there are special considerations, obviously, for babies. And we'll talk more about the some of the thermoregulation when we get into the malignant hyperthermia. That's another couple of weeks. Okay. We're going to talk in the next installment. We're going to talk about organ transplantation. Okay.